Diabetes mellitus. Okay, today's topic is about diabetes mellitus, and the reason I picked diabetes mellitus for today's lecture because it is considered as one of the most pressing health issue worldwide, and also it is considered one of the most fatal health issue worldwide. Unfortunately, anyone who is affected by diabetes mellitus will end up dead by complication of diabetes mellitus, most likely. The new research has shown that every 5 seconds, 1% of the population affected by diabetes mellitus will die due to complication of diabetes. Okay, for those of you who do not know me, my name is Dr. Muhammad Nasir Jolla. Without further ado, let's jump right into it. Diabetes mellitus. The main issue in diabetes mellitus is hyperglycemia. And why hyperglycemia happens? There are many reasons for that. One of the most common reasons is what? Insulin. When beta pancreas do not produce enough insulin, there will be low insulin secretion. When the beta pancreas produces insulin, but the biological activity of insulin would be low or insulin resistance would be present, again, there would be hyperglycemia or combination of the first and second one. The last but not least, the absolute insulin deficiency. Okay, so if it is low insulin secretion, in that case, diabetes mellitus. If there is a low insulin biological activity or insulin resistant, think about diabetes mellitus type 2, combination of the first and second one. Again, diabetes mellitus type 2. When there's absolute insulin deficiency, most likely diabetes mellitus type 1. Okay, diabetes mellitus. Let's talk about the types of diabetes mellitus. Diabetes mellitus type are two. Type 1 diabetes mellitus, and we have diabetes mellitus type 2. But there are a few important differences between them that we have to know. For instance, mostly type 1 seen in younger patients, less than 30 years of age. In type 2, mostly it is seen in older patients, more than 45 years of age. But what if type 1 happens in less than older than 30 years of age? It is called LADA. LADA means latent autoimmune diabetes of adult. But what if diabetes mellitus type 2 happens in younger than 45? In that case, it is called MODY. MODY stands for maturity onset diabetes of the young. Okay, another difference, mostly type 1 patients are thin. In type 2, mostly patients are obese or fat. Most common complication in type 1 is diabetes ketoacidosis. But most commonly, the complication in type 2 is HHS or hyperosmolar hyperglycemic state. Type 1 accounts for 5 to 10% of all diabetes mellitus, but type 2 accounts for majority of that, for most of them, more than 90% of all the diabetes mellitus. When it comes to antibodies against insulin, it is present up to 60% in type 1, but less than 10% in type 2. When it comes to treatment, type 1 is insulin dependent, so insulin is the main treatment. But when it comes to treatment of type 2, first line, we start with diet, lifestyle modification, exercise. For how long? For 3 months. If it fails, we jump to second line, which is metformin, and it's considered the best pharmacological treatment. And also third line, increasing metformin or combining with another anti-diabetic medication. And fourth, the last resort is insulin when hemoglobin A1C is more than 9. Diagnosis of diabetes mellitus. Before we do that, let's focus on the stages. We have 2 stages for diabetes. Pre-diabetic stages, we have a criteria for that, and we have a diabetic stages, we have a different criteria for that. For example, for pre-stages, FBS 6.1, 6.9, OGTT 7.8 to 11, hemoglobin A1C 6 to 6.4. But this value increases a little bit in diabetic stages. Like FBS will be a little high, like 7 or more than 7. Fasting, you know that no calorie intake for at least 8 hours. Hemoglobin A1C will be 6.5 or more than 6.5. And OGTT would be a little bit higher, like around 11.1 or more than 11.1. And random, the same 11.1 or more than 11.1. Random means any time of the day without regard to the interval since last meal. Notes about diagnosis of diabetes mellitus. This is very important to remember. It's all about the sign and symptom of hyperglycemia. When the sign and symptom of hyperglycemia present, like polyuria, polydipsia, polyphagia, weight loss, blurry vision, you do not need confirmatory tests. But if they are absent, you definitely need to confirm it with the FBS and also OGTT, which are the current recommendation for diagnosing of diabetes mellitus. Okay, let's talk about treatment of diabetes mellitus. But remember, before we jump into treatment, we have to know the glycemic targets. What are the glycemic targets based on the Diabetic Canada 2018 clinical practice? Keep hemoglobin A1C less than 7. Fasting, keep it between 4 to 7. OGTT or postprandial glucose 5 to 10. Lipid, especially keep it less than 2. Blood pressure, keep it less than 130/80. Diabetes mellitus type 2 treatments. Let's talk about this. This is very interesting and very, very important. What is the first line? First line diet, lifestyle modification, and exercise. For how long? For 3 months. If the patient is pregnant, 2 to 4 weeks. Remember that. So what if the patient fails to improve after 3 months? Second line. Second line is metformin, which is the best second treatment option, but the first best pharmacological treatment. Always start with a lower dose, and if it fails for 3 months, you tried it for 3 months and it fails, increase the dose or combine it. The new research has shown that after 3 years, 50% of diabetic patients will need a combination. And after 5 years, 75% of diabetic patients would need a combination. So what if this fails? Insulin. Start insulin when they fail or when hemoglobin A1C goes beyond 9. What is the ABCDES of diabetes care? A stands for A1C, less than 7. Blood pressure, B stands for blood pressure, keep it less than 130/80. C, cholesterol, especially LDL, keep it less than 2. Drugs, reduce the cardiovascular risk. Exercise, and healthy eating. Exercise 150 minutes per week, or diet, limit sodium, alcohol, and caffeine intake, smoking cessation, screening for complication, stress management. These are the ABCDES. One more important thing, sick day management. What is sick day management? If a patient is ill, we're talking about diabetic patient. If a patient is ill and unable to maintain adequate fluid intake or has renal function decline, or his or her renal function has declined, you have to hold off to some certain medication if the patient is taking. What are them? There's a mnemonic SATMANs. S stands for sulfonylurea, A stands for ACE or ACE inhibitor, diuretics, metformin, ARBs, non-steroid, and another types of oral anti-diabetic medication. Complication of diabetes mellitus. It's divided into 2 parts. We have acute complication and we have chronic complications. Acute complication is divided into 2 parts. I think we did mentioned this when we were talking about the difference between type 1 and type 2. Diabetes ketoacidosis most commonly seen in diabetes mellitus type 1, and HHS is most commonly seen in diabetes mellitus type 2. Chronic complication is divided into two parts, microvascular and macrovascular. Microvascular consists of diabetic nephropathy, diabetic retinopathy, diabetic neuropathy, macrovascular cardiovascular disease, ischemic stroke, peripheral artery disease. Okay, we have another complication apart from the microvascular and macrovascular, which is very important to remember, is dermatological. Tibia spots, acanthosis nigricans, very important to remember that it's more common diabetes mellitus type 2 and PCOS, eruptive xanthomas, and also necrobiosis, lipodica, diabeticorum, which is very rare. It's not very common complication, but it is one of the complications that you can remember. Bone and joint disease. It could be one of the complications of a patient who is suffering from diabetes mellitus, whether it is type 1 or type 2. The Deuterian contraction is more common in diabetes mellitus type 1, and it's associated with insulin and anti-diabetic medication. Remember, increased fracture is seen in both diabetes mellitus type 1 and type 2 due to decreased bone quality, adhesive capsulitis, cataract, and infection. Screening. For screening diabetes mellitus, 128 has stunning fork or 10G monofilament for diabetic peripheral neuropathy. Always begin your screening annually at the diagnosis for all type 2 diabetes mellitus, and more than 5 years or after 5 years of diagnosing of diabetes mellitus type 1. For example, retinopathy. When patient is diagnosed for diabetes mellitus type 2, do a screening right after that. But when it's type 2, you can do the screen after 5 years. But remember, there are some important things to remember. Note, if there is an early retinal damage in the first screening, the next screening should be done annually, every year or 1 year after. But if there is no retinal damage in the first screening, the next screening is supposed to be 2 years later. MCQ questions. We have a 60-year-old female with 15 years history of diabetes mellitus, and body mass index is 30. Today she tells you, I have been having these burning feelings in my feet that come and go. I'm worried about getting gangrene, and I'm losing my feet like my diabetic father did. The symptoms are worse at night. It is not related to exercise. Her hemoglobin A1C is high, 8.9, no fever, and no sign and symptom of trauma or arthritis. Arthritis is out. What is the most common, or what is the best diagnosis? Chocolate foot, diabetic peripheral neuropathy, C, all of the above, D, gout arthritis, E, rheumatoid arthritis. It's excluded. What are the keywords? 15 years, type 2 diabetes mellitus, BMI 30, burning feeling in my feet, okay, and hemoglobin A1C is 8.9. Okay, chocolate foot is painless swelling of foot in diabetic patient with at least 10 years of history. It is out. If gout arthritis is episodic attacks of the pain, redness of the joint, it's out. Rheumatoid has already been ruled out, so B is the correct answer. Another MCQ question. Which type of diabetes mellitus is associated with insulin resistance and acanthosis nigricans? Type 2, type 1, all of the above? None of the above. We know that type 1 is an absolute insulin deficiency. So this is out. Is the correct answer then? Okay, another MCQ question. 55-year-old obese woman presents with a complaint of velvet hyperpigmented plaque. What is it? It is acanthosis nigricans. Where is it? It is on the skin, commonly affecting axilla, groin, and neck. These are the common locations. The rest of the history is unremarkable. Okay, history is good. So it means history is done. The question is, what is the best next step after complete history? What is the next step? I read it. I wrote it in red because it's very important. Is it starting with the dash, lifestyle change and weight reduction, getting a detailed history? We already did that. Do a thorough physical examination. This should be the answer. Yeah. E, check for FBS. Too early. We don't have the diagnosis. The keyword: 55-year-old obese, velvet pigmented, acanthosis nigricans. Dash is best initial treatment for hypertension. This is out. Lifestyle modification is best initial treatment. We don't have the diagnosis. History, we have already done it. This is the best next step after history. FBS, we can do it after physical examination. Best next step after physical examination. Then D is the correct answer. Here we go. Thank you very much for watching this informative medical video. If you have social media, please subscribe our channel, like, follow, share our video, and support us. Thank you very much. This video is prepared and posted by me, Dr. Muhammad Nasir Jawla, and the main purpose of this informative video is to keep our Afghan female medical doctors, healthcare workers, current with the most updated medicine, because they have been deprived from their basic right, which is studying and saving lives. Also, IMG can benefit